How many times have you heard someone say that they're so OCD about something? Well, unless they're part of 1.2 to 2.3% of the population that have been clinically diagnosed, they're either lying, don't understand the disorder, or they should see a professional. OCD is part of a broader category called OCRDs, obsessive-compulsive and related disorders, where you'll find hoarding disorder, body dysmorphic disorder, trichotillomania, which is an obsession with hair pulling, and excoriation, which is an obsession with skin picking, and OCD. Think of obsessions as a tendency for mosquito bites to appear in the brain. They're these intrusive and repetitive things you need to itch, and then compulsions is that reflexive itching. Neuroanatomically, think of a gearbox that got stuck, and that gearbox is called CSTC. C as in the cortex. You have the orbitofrontal cortex, which is responsible for appraisals or values, and you also have the anterior cingulate cortex, which is responsible for identifying problems and conflicts and errors. That goes to the striatum, which is basically a habit station or habit learning station, then to the thalamus, which is the mind-body connector, and then back to the cortex, specifically the dorsolateral prefrontal cortex, which is responsible for inhibition. People with ADHD have problems in that region. And it's so interesting. And there's different types of OCD, of course. There's symmetry, there's rituals, there's fear of contamination. And, another interesting thing is psychopathologically, OCD can look a lot like schizophrenia because they both involve these intrusive thoughts and irrational behaviors. But the one big difference is that in schizophrenia, you lack insight or an understanding that something is wrong. In OCD, you know something's wrong, but it's very tough to stop.